For the development of pharyngeal apparatus and of course head and neck, we need three germinal layers. This is the ectoderm, it's neuroectoderm through which we get specialized cells called neural crest cells. Then we have got paraxial mesoderm and lateral plate mesoderm. Let's see another picture. Here you can see the neural crest cells that take part in the formation of mesenchyme required for the head and neck. And this is the mesoderm layer. Now see, this is a tubular shape of an embryo, and you can see over the neural fold these glistening starry appearance of the neural crest cells. They are present on both edges of the neural fold of the neural tube. See what they're gonna do. In this shrimp-shaped embryo, you can observe that these cranial neural crest cells are there to take part in the formation of the pharyngeal apparatus. Now see how they are moving in their respected pharyngeal arches from the cranial region to form various structures of the head and neck. Yes, at the week 4, the embryo grows not only in the rostrocaudal axis but also as a lateral axis. So concentrate on this picture if I can enlarge it for you, that this is the cephalic end of an embryo and this is the caudal end. Here you can see the dilated portion of the brain vesicle, and this is the pericardial bulge. So in between you see a small opening, the future mouth, which is called as stomodium. And where is the neck? There is no shape of the neck here. For that, the pharyngeal apparatus has to come into action. See. Now again concentrate that this is the head end, this is the pericardial bulge and intervening stomodium. Now we see that here we can imagine that there is a primitive gut, and the most cephalic portion of the foregut is called as primitive pharynx, and on its lateral and ventral walls we see dilatations like the brachial gills called as pharyngeal arches. Okay. Okay, again concentrate in this picture. This is the head region, this is the pericardial bulge, this is the stomodium. So concentrate here that this is the neural tube portion, and anterior to it or ventral to it we could have the primitive gut, and most cephalic portion of the foregut is called as primitive pharynx. And around the primitive pharynx we have in its lateral and ventral walls the development of pharyngeal arches. So see, this is a curved shaped embryo and we are cutting a section to view the pharyngeal arches. Let's see. So the outermost, that is shown in blue, is the ectodermal covering, and the green color portion in between is the mesoderm, and the inner yellow color is the endoderm. And here you can see that the endoderm is approaching towards the ectoderm, and this area is called as pharyngeal membrane. And when we are viewing the embryo ventrally, in the very center we can see this is the stomodium, and the membrane covering it is called as oropharyngeal membrane. Okay, in this view this is the cephalic end and this is the caudal end. It is just to show you that this is the neural tube, and from here the cephalic region, and this is the prosencephalon, this is the mesencephalon, and this area is the rhomencephalon. This rhomencephalon, here the neural crest cells are migrating in the respected pharyngeal arches. This diagram is to show you all this detail. Okay, we have cut the dorsum of the embryo and placed it in front of you to show you that these are the pharyngeal arches. So this is the first pharyngeal arch, this is the second, this is the third, fourth, and sixth. Fifth never formed, or if it formed, it regressed. Okay. Now see that the outer groove-like structure that is separating the first arch from the second is called as pharyngeal cleft, and this is the first cleft. Now see, this is the second cleft, third and fourth. And same is the case that on the inner side, the endoderm is going to form the pharyngeal pouches. In between the first pharyngeal arch and the second, we have got first pharyngeal pouch. This is first, this is second, this is third, and fourth. Fifth is rudimentary. Okay. Okay, this diagram of the pharyngeal apparatus will show you the derivatives of respected pouches as well. So you should be knowing that these pharyngeal pouches, pharyngeal arches, and pharyngeal clefts, including pharyngeal membrane, these four things form the pharyngeal apparatus. So see what happens, that the pharyngeal cleft first is there, but due to the overgrowth of the second pharyngeal arch, the second, third, and fourth just become rudimentary, and finally they will form the cervical sinus. Now you see that the first pharyngeal cleft will be forming the external auditory meatus, and if we see the inner side, which is a pharyngeal pouch, it gives rise to the primitive tympanic cavity, or called as middle ear, and along with it, it will give rise to the auditory tube. So now if you concentrate, this is the first pharyngeal membrane formed by the ectoderm outside and the endoderm inside. So it is gonna form the tympanic membrane or eardrum. Okay, now come towards the second pouch that give rise to tonsils, especially the palatine tonsil, and of course the tonsillar fossa. Now if you concentrate in the third pharyngeal pouch, you see it has got the yellow color dorsal wing and red the ventral wing. The dorsal wing is giving rise to inferior parathyroid gland, and the ventral wing is going to give rise to thymus. Now concentrate on this fourth pouch again with the two wings, the dorsal in yellow color now give rise to superior parathyroid gland, and this blue ventral wing is showing, and it is forming the ultimobrachial body. The parafollicular cells are derived from them to produce calcitonin, and these cells will migrate into the thyroid gland. Okay, let's see another picture. Now, this picture is very well clearly showing you the external auditory meatus formed by the first cleft. Now, it's very interesting that only first cleft takes part in the formation of a structure. The rest of them doesn't. Now this diagram will show you the external auditory meatus and will be showing you the middle ear cavity and auditory tube. And of course, in between you have got eardrum. Thanks, other clefts are obliterated, and you can see just the cervical sinus here. Now see the palatine tonsil in the second pharyngeal pouch and enlarged parathyroid gland, which is inferior, and the thymus from third pharyngeal pouch, and the fourth pharyngeal pouch is gonna produce the superior parathyroid gland, and its inferior portion will form the ultimobrachial body. This is the descent of the thymus, which is coming in front of the neck and carries inferior parathyroid along with it to be fitted on the back side of the thyroid gland. Now, a schematic representation of the pharyngeal clefts, initially first, second, third, and fourth, and the pharyngeal pouches first, second, third, and fourth, and the Roman number is showing us the pharyngeal arches 1, 2, 3, 4, and of course 6. Now see the components of the pharyngeal arches. Every arch must have in the center few things. So let's see, it must have got its own artery, its own nerve, it must have its musculature, and the cartilage, later on the bony tissue. So we should know that all these things are the components of the pharyngeal arches. Now see the lateral aspect of an embryo. You can see that this is the first pharyngeal arch. It has got two parts. The first process is maxillary process and other is the mandibular process, which is in embryonic period is called as Meckel's cartilage, later on develop into the mandible. These two processes form the first arch, most popularly known as mandibular arch. Now see that second arch is called as hyoid arch. This is the third arch, this is the fourth, and of course there will be the sixth one. Now see that this is the first pharyngeal arch that give rise to various structures, in which we see there is a Meckel's cartilage, the future mandible, we see the malleus and incus, and the sphenomandibular ligament. In addition to these things, there are other bones called as maxilla, the squamous part of temporal bone, the zygomatic bone. All these are also derived from the first pharyngeal arch. Now see the blue color line showing the second pharyngeal arch. The cartilage here is called as Richard's cartilage. It gave rise to stapes, another ossicle. Then the styloid process, the ligament is the styloid ligament. And we see this is the hyoid bone. The upper part of the body and the lesser cornu are formed by this second hyoid arch. Then concentrate on this yellow third arch that gave rise to lower part of the body and the greater horn of the hyoid bone. Now see this yellow color, the third pharyngeal arch that gave rise to the body of the hyoid bone, the lower part especially, and the greater horn of the hyoid bone, right? Now concentrate in the red color showing the fourth pharyngeal arch that will form the thyroid cartilage, and concentrate on this sixth arch that is also taking part in the portion of the thyroid cartilage formation and the cricoid cartilage. And if we see them posteriorly, the arytenoid, the corniculate, the cuneiform are also formed by the combination of this fourth and sixth pharyngeal arches. Okay. Now concentrate on this chart showing the derivatives of pharyngeal arches. So the first arch, called as mandibular arch, consists of two processes, the mandibular and the maxillary. Okay, we must first recall that this arch must be supplied by fifth cranial nerve. The second arch, hyoid, is being supplied by seventh cranial nerve, the facial. The third arch being supplied by ninth, the glossopharyngeal, ninth cranial nerve is going to supply. Then the fourth and sixth, they are supposed to be supplied by the vagus nerve through its superior laryngeal branch and the recurrent laryngeal branch respectively. The superior will supply to the fourth arch and recurrent will supply to the sixth arch. Okay, now concentrate that this mandibular arch, which is responsible for the production of muscles of mastication, is involved in the process of chewing, or you say munch. So we see that the muscles of mastication includes temporalis, the masseter, the medial and lateral pterygoid, and then we see that there is a hyoid muscle, mylohyoid, and we get the anterior belly of digastric. Other derivatives are tensor palatini and tensor tympani. So we have make a mnemonic M3 at 3, right? Now see that what skeletal structures are being formed via this arch. The maxilla, the zygomatic bone, the squamous part of temporal bone, the Meckel's cartilage that will become the mandible, the two middle ear small bones, the malleus and the incus, and the ligament, anterior ligament of the malleus, and the sphenomandibular ligaments. So we see so many bones and two ligaments being formed by the mandibular arch. Then you see that through this hyoid arch or second pharyngeal arch, this is meant for facial expression, and muscles for these facial expressions will be derived from the second arch. So after eating some good burger, after munching, we either smile or become sad to show that we are showing our facial expressions. Now you see the second arch that shows the derivatives, the facial expression muscles, as we are showing after munching or eating. Either our face gives smile or we seem to be sad. So expressing our feelings via facial musculature that includes buccinator, auricularis frontalis, platysma, orbicularis oculi, and oris, and posterior valley of digastric, and two muscles of hyoid bone and the medullary ossicle, respectively, the styloid and stapedius. This arch is showing a word S for smile or sad and represents PF boss, initials of these musculature to make you remember. And the skeleton includes just stapes, the third ossicle of the medulla, the styloid process, and one ligament, the styloid ligament. And we see the lesser horn and upper portion of the body of the hyoid bone being formed by it. Then see the third arch, only this having one musculature, the stylopharyngeus, and we see the lower part of the body of hyoid and greater horns are being derived. The nerve is glossopharyngeal, and this muscle will help us in swallowing. Now concentrate on the fourth and sixth arch to do swallowing and the process of speech. So what we see? We see here the derivatives in the musculature, the cricothyroid, the levator palatini, the constrictor of the pharynx, and for speech, intrinsic muscles of larynx. These constrictors, these take part in the phenomena or process of deglutition or swallowing. So the intrinsic muscle is list mention us the speech or helps us to speak. So we can swallow, then we express our feeling by speaking. So what cartilages are there? The laryngeal, except epiglottis, rest of thyroid, cricoid, arytenoid, corniculate, and cuneiform, they all are formed by this fourth and sixth arches. So start with the mnemonic. If we say it when we eat a food, we are just munching or chewing. After that, we either smile or become sad. Either the food is good or we don't like it. Then we start the process of swallowing. And later on, we say, yes, the food is very good, or that is just an ordinary food. So, all these will show us the details. Now, here we should learn about the skeleton being derived from the first pharyngeal arch. So, see, first there is a maxilla that is formed by the maxillary process of the first pharyngeal arch. Then we see the zygomatic bone. Then you can observe the squamous part of the temporal bone. These are being formed by the maxillary process of the first pharyngeal arch. Now, you, in addition to this, see that the Meckel's cartilage will later on transform into the mandible. Okay, then you can see few portion of the bones derived from the second pharyngeal arch, that is the steloid process. Okay,